So I think a lot of what we're doing is kind of looking at some of these larger issues and saying, how do we look at our food system from a sustainability point of view? How do we look at changing it so that it's not dependent and reliant on a source of energy that's temporary, that has a lot of effects on the world? But beyond that, I think there's other issues. I think there's the issue of childhood obesity, health. With a lot of the industrial agriculture, we have a lot of corn syrup, corn-derived products, and things like that. Not only is there a lot of fossil fuel that goes into that, but it's not healthy for people. We have a lot of problems with obesity, diabetes, heart disease. It has an economic impact in terms of lost productivity. It has an impact on quality of life. People are much more sedentary.
My name is Esther Muchiri. I actually come from Kenya, from a farming community, so I definitely understand and have grown in a perspective of food just growing to where you are. And I appreciate healthy food, fresh food. And coming here to the U.S., I had a very interesting experience where I went to the supermarket and I bought stuff and it didn't taste like food. It didn't taste like food, or like what I'm used to. And just working with kids and starting to ask them to eat healthy, fresh food, and they couldn't even, they weren't ready to do that. They were opposing every aspect of me trying to force fresh food to them, or even knowing the importance of eating fresh food. Really struck a chord in my heart, and I started very seriously looking into ways of, working with communities to make sure that people are growing their own food and eating it from right where they live.
Food desert is a phenomena where you have very limited access to healthy food choices in a neighborhood. We, for instance, in this neighborhood live in a food desert, where we are at Miles and Broadway. The closest grocery store is about 2 miles away from us. There are neighborhoods here where, within a 2-mile radius there isn't any fresh produce available, fresh or healthy food choices, not just produce. So there are studies that have shown that people who live in food deserts tend to eat fewer fruits and vegetables irrespective of their income. So if you compare low-income people living in neighborhoods which have outlets of fresh produce, whether it's a grocery store, a farmer's market, or what have you, they tend to eat better than people who live in food deserts where there aren't any outlets of healthy food choices.
And especially coming to this country and realizing how people are detached from their food, the food that they eat, which is the central thing. It's a basic need. It's a basic need. And if we don't think about it, who are we going to be? I mean, we can't develop without a healthy workforce. We can't develop without, we can even look after ourselves if we're not healthy. It's as basic as that. And when we move away from food, that's why I see all the problems that we struggle with, especially in a country, in developed countries.
If you look at how people spend their food, what fraction of their income people spend on food, in America people spend the lowest amount on food out of their entire income. We spend about between 9 to 11% on food compared to other countries where it's between 20 to 80% depending on their economic level. So food, while we complain that it is expensive, it's good to realize that we really don't spend that much on food. The problem is some of the food is really available at extremely low cost, and often those low cost foods are low quality foods also. And by low quality foods, what I mean is that they're nutritionally really low in quality. They're very high in sugars because you can buy high fructose corn syrup at very low cost in the market, so you see it on a lot of food products. And some of the foods that we see people eating it's just sad. There is a lot of prepared food coming into, people are consuming foods that are prepared away from home quite a bit. There's a lot of fast food. There's a huge amount of soda consumption. Sometimes we see 10 or 12 servings, a serving is only in 8 ounces, but we see people consuming 64 to 80 ounces of soda in a day, which is just a huge amount of calories without any other nutrient in it. What we don't see a lot of is very little of vegetables, very little of fresh vegetables being consumed, and very little fruit, and minimal dairy. If you eat healthy food, if you eat a diet that has a variety in it, eating from the different food groups, eating more fruits and vegetables, eating more whole grains, eating from low-fat dairy, and choosing low-fat or leaner cuts of meats, and eating beans and other sources of protein in your diet, your risk for chronic diseases goes down substantially. You're better able to manage your weight. And there are many barriers to eating at the level where the recommendations are. And one of the issues is related to access and availability. But we also collaborate with programs like CityFresh, where not only are we providing the education and the tools for people to stay healthy, but we are also changing the environment by which, when these two things, when education and environmental changes come together, we see the fruits of that very evident. We evaluate our nutrition education program, and last year on a small sample, what we found was that people who participated in our nutrition education sessions at CityFresh Fresh Stops doubled their consumption of fruits and vegetables. Now that's, I have been doing nutrition education for a long period of time, and I have never seen changes of that magnitude. So it's the environmental change coupled with educational change that's going to bring about the behavior change that we are all seeking.